This session is going to be on healthy workplaces. The intent of this session is to learn much more about how healthy workplaces can be created. We are intending to have this session more in a workshop mode, whereby the speakers would be sharing their experiences, but we are also looking forward for the audience to perhaps ask questions as well as take some learnings back. So may I now invite the chairperson of the day, Dr. Manju Bala from ONGC, to please come on the dais. So Dr. Manju Bala is the head of medical services at ONGC, quite an experienced campaigner in this field, and it's great to have you with us, ma'am. Can I now invite Dr. Sandeep Sharma, General Manager, Medical Services. He's presently the secretary and the organizing key stakeholder for this conference. Can I now invite Dr. Sriniket Mishra, Chief Medical Officer, Hero MotoCorp, on the stage. And it's also my proud privilege to invite Dr. Andrew Tay. He's the Director of Health and Wellbeing at National University of Science. You're most welcome, Dr. Andrew Tay. I'm going to hand this over now to Dr. Manju Bala for taking us forward.
Good morning, everyone. Thank you, Dr. Ashish, and for briefing us, all of us, about the healthy workplaces. Now the first speaker is Dr. Sandeep Sharma, and I just say a few words about him. Dr. Sharma is a technically accomplished medical specialist with over 16 years rich experience in medical management, medical advisor, health, safety and environment management with Indian Oil Corporation Limited. He is presently heading Health Section of Corporate HSC Department of IOCL, responsible for monitoring, budget control, setting maintenance standards, providing expert services to all the 8 refineries of IOCL. He is presently the board member of International Commission on Occupational Health. He is also the convener of the Scope Health Committee. In addition to this, he is also responsible for formulating the safety, health and environment policy of IOCL and also coordinating the health, safety and environment efforts of all the divisions at corporate level. Headed the Occupational Health Services, Emergency Medical Services and Surgery Department of Mathura Refinery Hospital of IOCL as Deputy Chief Medical Officer for around 12 years. Headed the committee for establishment of Paradip Refinery Hospital of IOCL, formulation and issue of guidelines on health, safety and environment and ensure implementation of the same, planning, organizing and conducting advanced training programs on occupational health and safety. Now I request Dr. Sandeep Sharma to please give his oration. I think this I'll continue till the time this is there. I am Dr. Manju Bala. I am working as a general manager in ONGC, and WHO has taken this initiative for healthy work environment. This main initiative is to promote this thing, healthy workplace, and create awareness about the other well-being of the employees, and to create a collaboration between the employer and the employees, so that the
very warm welcome to this professional development course of OCUCON 2023. That is the 73rd National Conference of Indian Association of Occupational Health. And today we are here to start this workshop. And this workshop actually basically tells you about how we can work upon at our workplaces and create healthy workplaces. And these healthy workplaces, they will be as per the WHO healthy workplace model. So you all know that we all work very religiously, and we put in lot of untiring efforts in our day-to-day activities in our respective industries, but many times our activities, they are just labeled as welfare activities. But our activity is basically for the business continuity, and we have a great role to play. And this pandemic for last 2-3 years, it has shown that preventive health, workplace health, healthy employees, healthy workforce, that is very important. And that is the reason why we all should focus on a healthy workplace. And WHO healthy workplace model, that is the best example how to create healthy workplace. And this, it incorporates all the activities which we all are doing, our management is doing, our workforce is doing, our HR team is doing. So it will incorporate all these activities. When we won the Global Healthy Workplace last year, I am in health safety environment. I am basically from medical department, but I am posted in HSC. So when we won the this Global Healthy Workplace Award, there was a COVID review meeting, and in which our director was also there, our executive directors from all divisions, HR, HSC, everyone was there. So मतलब they were thinking कि ये सारा काम तो हम लोग करते हैं, HR वाले करते हैं, CSR वाले करते हैं, बाकी लोग करते हैं. Then how a doctor can present and he has won the award for the company, but we have to keep them also in good spirit. So I said, I'm in corporate office. I know that you all are doing all these activities, but these activities, they need to be compiled and they need to be presented before the global jury. So it is basically the team effort from any corporation which has to be put in the WHO healthy workplace model, and that will give you the result. So basically this will improve upon our medical fraternity image, our HSC people image in the eyes of management. So this healthy workplace model, if you work, it will give you lot of appreciation in your respective organizations. So that is the reason why we thought ki we should keep it this year as a workshop theme, and in which Dr. Andrew Tay is here. He has just won in 2022. He has won this Global Healthy Workplace Award he is from National University of Singapore. In 2021, 2021 Indian Oil won the award. Then previously Dr. Shirniket Mishra from Hero MotoCorp, he won the award. Then from GSK, Dr. Ashish Vijay Jain, he has won the award. So we thought we should put in our experiences before you, so that you all get inspired by these activities, because हम लोग भी मैनेजमेंट ने अवार्ड जीत लिया. अवार्ड तो बहुत जीते जाते हैं, यहाँ पर कोई गोल्डन पीकॉक अवार्ड है, कोई कुछ अवार्ड है. डे इन डे आउट मैनेजमेंट इज जस्ट रिसीविंग द अवार्ड्स. बट what our chairman said, he said we have won the award, but we should implement it to the ground level, to the units, to the locations. And in this we are doing all these efforts in different fields to implement it across the corporation. And the same way other colleagues also, they will explain how they have integrated all these efforts and how you will be benefiting from this WHO healthy workplace model. If you implement it, it is easy to convince. कोई नया चीज़ लेके आप मैनेजमेंट के पास जाओ तो 10 क्वेश्चन पूछते हैं कि ना वाई दिस, वाई नॉट दिस, ये कहाँ पर है, वो कहाँ पर है. तो इफ़ यू आर हैविंग ए वेल एस्टेब्लिश्ड model before you, then it is easy to implement, it is easy to convince the management, and management will be a part of this WHO healthy workplace model. I'll just explain you from Indian Oil perspective what we have done. So Global Healthy Workplace Award winner for 2021 under large employer category was Indian Oil Corporation, and for this we had applied, that was in early 2021. So being a energy of India company, a Fortune 500 company, we had all the things in place which a WHO healthy workplace model requires. So you have to go through this model, and understand what are the components of this model, and accordingly, if the things are existing in your company, then definitely you should go for applying for this WHO healthy workplace model, global healthy workplace model. So Indian Oil, it has got lot of verticals. We are working in different areas to provide energy to India, and number one very important thing is we have got all the policies and guidelines in place, and this you have to depict, this you have to show to the jury also, that all the policies, all HSC policy, energy policy, your biomedical waste policy, your CSR policy, all these policies, they are in place and they are signed by the top management. So these are approved by your respective board of directors and chairman, and this you have to show कि your policies are in place. Number two, you have to show that you are a responsible organization and you are not creating any hazards, and if there are any hazards, they are being taken care of. Then WHO healthy workplace model, what it speaks is at the core is the ethics and values. Ethics and values, as I told you, means all your policies and other things, they are in place, and you have some core values, you have some ethical responsibilities that you are following, and you are not creating any harm to the employees, to the society, that you have to ensure. And regarding this, the 4 verticals which are important is the personal health resources that you have to take care, in which like providing fitness equipment, healthy food choices, no smoking policy, all these things, they are existing in all organizations, but it is our responsibility to package it and show it to the global healthy workplace award jury. Next is the CSR activities. Lot of CSR activities are being done in the field of health also by the respective companies. So all these things, they can be projected. Then we are taking care of the psychosocial work environment, means you take care of the employees' mental health issues. You have some employee assistance program in your organization where counseling can be done of the employees, so that they are involved in the day-to-day activities and they don't feel stressed out. Then physical work environment, this also we are all doing day in, day out, like medical examination of our workers, environment monitoring, then identifying all the physical, chemical, radiological hazards and keeping them within the normal limits. And then all these things, they need to be compiled, and accordingly we have to dot down all these things. Then we have to show the leadership commitment and the leadership involvement. Leadership commitment means your top management, they should sign some policies, like for the sports stars, or for the health policies, HSC policies. Then they have to you should get them involved, like taking them for the whenever you have some health related program, you just ask them to join, so that they can workforce, they get inspired by these activities. So leadership involvement is very important. And WHO healthy workplace model is such that I think most of our organization, the good organization, they are all aligned with this WHO healthy workplace model. So only thing is, we all industrial physicians, we have to take effort to compile all these activities and show it to the jury. So this is about the leadership engagement. Whenever there is some activity, you ask your top management to be a part of it. Our leadership, it always leads the way, and leadership also, when we ask them to come to some function, they also come to know what all activities we are all doing. So otherwise, when you go to the chairman or to directors, they might be not knowing what all health activities, what all other health related activities you all are doing. So when we ask them to come to these programs, they become more aware. They will help in whatever program you want to initiate. So, and people, like we started this tuberculosis free Indian Oil workplace program. So when our chairman, he himself inaugurated this program, and he wants everyone to get themselves declared that we are tuberculosis free. So workers, they also feel that it is their responsibility to be tuberculosis free. So healthy workplace, this we have to show to the management, to the workers, and workers involvement, that is also very important. We have to involve the staff, we have to blue collar, white collar, everyone has to be involved. It should not be an activity of our occupational health center or our hospital. Everyone should be involved in the activity. We should organize camps, we should involve people in marathons, in walkathons. All these type of activities, they will involve the worker, and when they find it useful, your momentum will further gain momentum. So this is the WHO healthy workplace model base, in which you have to utilize these unions, associations in your respective organization. You should try to talk to them why your health programs are important, how they will benefit the employees. So there will be more and more participation from the employees and workers and the officers also. Then you have to showcase what all good things are in your organization. All these activities which are all documented, they are being managed by are important part of our workforce, and we have to show what all programs we are having in our respective organization for women leadership and for women engagement. So this is very important, and this we have to, if we are not having such established program, we should start it, and this is very important thing to do. Then, as I told you, ethics and values, all the policies, they should be signed by the management, they should be released by the management, and management approval should be there for all these ethics and values. Then, as I told you, this inclusive work environment with our workers, unions, everything, it should be there. Then, wherever statutory compliances are there, that we have to showcase ki we are managing all the statutory compliances, biomedical waste, environment management, wherever like they can ask if you are having equipment in your hospital, whether they are being calibrated, they are being monitored. So all these things, whatever the statutory requirements are there, you have to show that they are being complied by your respective organization. Then you have to show that whatever things we are doing, that you have to showcase ki every component mein what all things we are doing and what are the benefits of this. Then physical work environment, how you are taking care of, you are providing all the necessary gadgets or necessary PPEs to the employees. If the illumination is less, you are creating proper illumination. If noise is there, you are providing ear muffs, ear plugs, or the noise barriers, everything you are doing, monitoring of the audiometry you are doing. So all these activities you have to showcase that you are maintaining the norms of the physical work environment. Then all these activities you have to show. Then show your what all efforts you are doing for maintaining all these activities and keeping your physical workplace healthy, and how you have integrated your occupational services with other activities, that also you have to show. Like our organization, we have 9 refineries, 9 hospitals, we have got a big workforce. So all this, they are spread out across India. How you have integrated them, that you have to showcase. Then if you have some efforts in the field of digitalization, that you have to showcase that how you are digitalizing all the medical examination reports, you are doing analysis of the reports, and you are maintaining a database of all health related activities. Then if any publication is there from your side, that you have to showcase. Like from Indian Oil, we had published a lot of manuals, so that we had showcased. And in addition to showcasing them, if you have soft copy, you just upload them on the drive and provide the link to the judges, so that they are aware and they can go through your these manuals. So this is very important. And any other activities which you think you are doing it in a unique manner, like fatigue management in Indian Oil we are doing, then psychosocial work environment that you are doing, managing stress we have published this manual, then emailers we were sending to all our employees across the corporation, then we had launched this project happiness and well-being. So all these activities which are unique to your organization that you should always showcase. Then if you are having some e-learning modules like during COVID times, organization they are developing e-learning modules. So what happens ki our like whatever is our domain, like we are energy sector or automobile sector or whichever sector. So what happens, e-learning modules they are being developed by the engineers, by the HR people, by other people, but from occupational health side, from medical side, we should also develop some e-learning modules, and we have developed these e-learning modules during last 2 years, like advancing a culture of promotive and preventive health. Then all these I have noted down there, like canteen hygiene index, psychosocial work environment, then managing stress at workplace. So all these e-learning modules, they are unique and they are very lucrative for the employees, and this creates a lot of impact to the jury also. Then personal health resources, what you are providing club facilities, you are providing the gym facilities, you are providing other equipments to them so that they remain healthy. Then canteen hygiene index is unique to Indian Oil Corporation that we started. Then beyond health related activities, what all things you are doing, like club facilities, like Zumba classes or any other activities which you are doing, that you have to showcase. Then any employee assistance program in your organization which you have started, that you have to showcase. And targeted health promotional programs. Normally what happens, every unit, every location, they organize some camp with the help of some local hospitals, but everything should be documented and it should be shown how many programs we have done, in which discipline we have done these programs, who were the target beneficiaries, what is the analysis, and after that we have analyzed the report, how these camps they have helped the employees and how it has reduced the medical cost and other things. So if we do the programs just for the program's sake, it is of no value, but if you do it with a tangible benefit for the management and for the workers, then it creates value and it gives lot of impression upon the jury also. Then CSR activities, now every community is doing CSR, every organization is doing CSR, all health related CSR you have to showcase, like providing wheelchairs, then contributing to the national building, like Swachh Bharat Abhiyan, every organization is doing, but that you have to showcase. This TB Mukt Abhiyan, every organization has to do, this also you can showcase what are your efforts. Then for clean fuel, what you are doing, like from Indian Oil we have done this, we are doing this Bandicoot sewer cleaning, robotic sewer cleaning in CSR. So because we have seen that lot of workers, they die because they go inside the sewer for cleaning and they are dead because of the confined space gases. So like in addition to your health activities, you are also looking after the environment. Like Indian Oil, they have adopted this rhino as our logo, and we have been pioneer in this bringing cheetah to India. So these are basically nation building activities. So CSR not only means you are related to the health related activities, what are the nation building activities that CSR is taking, that also you have to showcase. Then net zero, that is also environmental, like it is environment related, but you have to showcase all these activities. Then providing sustainable solutions to the country, so that you have to showcase what all alternative energy things you are doing, or any other activities which helps in building the nation, that you can showcase. So this will help in the building up of the society, keeping the society healthy. So basically, WHO healthy workplace model, what it aims at, in the core of it is, like we are an industry, like we are in a boundary wall. We are doing everything for the safety and health of our employees, but we are also looking after beyond our boundary wall. So that we are taking care through the community social enterprises, so by the CSR activities to keep the surrounding population healthy, and we are not creating any hazard to them. We are taking care of them. We are taking care of the environment also. So all this holistic approach, if you show during the your presentation and in your application, it will definitely help you in again winning a Global Healthy Workplace Award, and India would be a WHO Healthy Workplace model for everyone in the industries. So these are some of the activities which we had shown, and ultimately because of our focused approach, we won this Global Healthy Workplace Award. And award winning is very common in industries, but we have to showcase that yes, we have done the good work. You have to take your chairman, your directors into confidence. Then they have to be the torch bearer to further take it forward in your other units and location and to other industries. And that is the reason why Indian Oil has supported this particular conference to take forward this WHO healthy workplace model, to keep everyone healthy, well-being, and taking care of the environment. And for this reason only we have decided this workshop, and this is how you all can be inspired by the WHO healthy workplace model, how to take it forward in your respective organization and bag this healthy workplace award. Because getting an award is a different thing, but getting it for your company, your employees, your society, your environment, that is a big thing. And it is a WHO, it is an authorized model, and we have to work for it. And this is for this reason we have organized this workshop. And thank you all very much. There are so many Global Healthy Workplace winners. They will also tell you what all things they have done in their respective organization to bag this award. Thank you very much.
Thank you. Thank you, Dr. Sandeep Sharma. Thank you.
Thank you, ma'am.
Our next speaker is Dr. Ashish Vijayan, who is the head of EHW Asia, MEA Russia and CIS, GlaxoSmithKline PIC. Dr. Ashish currently is the head of EHW Asia, MEA Russia and CIS. His role involves developing, implementing and leading strategic evidence-based business solution on health and well-being, resilience and mental health, health promotion and non-communicable diseases for employees at GSK. His leadership and contributions have resulted in GSK winning several awards globally, including Global Healthy Workplace Award, International SOS Duty of Care Awards, Singapore National Health Award, AIA Healthiest Employer Award, Malaysia, Health and Wellbeing Award at Philippines and Sri Lanka, and several others. He is a sought-after speaker and has presented at various national and international forums, including WHO, World Economic Forum, Global Fund, TCH, CII, and others. He is also involved professionally with IAOH as its life member for more than 10 years. At the same time, he has also a keen interest on the academic front of OH and is involved as editor of Qclave E magazine 2017 current, and he is also an associate editor IJOEM 2020 current. So now Dr. Ashish Vijayan may start, please.
Good morning. Am I audible at the back? All right. So a warm welcome to all of you. It's It's really a very cold morning, and I want to really appreciate all of you who have been brave enough to come today. The hall appears to be much more cozy now. The intent of today is to have more of an interaction on what are the different aspects of healthy workplaces. Dr. Sandeep has already covered a lot of things out there. Now, what I'm going to do, and I was intending to walk extempore and have these discussions. But I think as we go forward, I just also want to think of what does it mean for each of us in the terms of what is our role to influence the management, how we can make a difference to the thinking, to the strategy, to the implementation, and finally, how we can ensure that the management appreciates the value of health and well-being, just not the management, but also the employees going forward. So I think it goes without saying when we say that we need to have healthy employees, healthy organizations, that is what makes healthy workplaces. Now, how many of you belong to the industries? Any show of hands? All right, I think most of us. What is the basic challenge when we think about ourselves as occupational health professionals or as EHS professionals? I think the number one challenge is we need to start thinking beyond compliance. And for the management to understand, occupational health is just not about compliance. It is much more. It is about caring of the workers. It is about looking at the health and, in short, becoming much more productive for the future. So what we need to start thinking even before we start thinking of global healthy workplaces is how do we start changing the thinking and the mindset of the management? How do we start building up the culture? So being part of GSK, I've been fortunate to actually have a very good management support on the things which we do for health and well-being. I also see in the crowd some of my ex-GSK colleagues who are out here today. And I'm sure that they can also vouch for what we have been doing out at GSK in the field of health and well-being. Next slide. So Dr. Sandeep talked about the WHO Healthy Workplace Model, and I think I don't want to explain this enough, but what this basically talks about is 4 components: physical, mental, personal health resources, and enterprise community. When I say enterprise community, it is about what do we do for our country, for our community. It is also inclusive of CSR. But where I want to focus is on the central aspect. Because if I honestly ask each one of you, you love your jobs. Where do you find the most difficulty? Sometimes to get something extra from the management if you want to really implement an intervention. And I think what I want to focus today is how do we start building the business case on health? How do we talk like the management so that we can influence them and then do our job successfully? So I'm going to focus on the center, which is about leadership engagement. I'm also going to talk about how values can create a difference. But more importantly, I'm going to also give examples of 3 organizations who have done some spectacular work using this framework. Now, my question to you, how many of you have seen this model before you came out today? Some of us? All right. So why are we talking about this model? And I'm opening this up. Anyone wants to answer? Ramanjit, why are we talking about?
Looks very inclusive.
Yeah.
It captures all the aspects of occupational health as well as the administration.
Fantastic. So Ramanjit has said that it's very inclusive, it is strategic in nature, it captures everything, and it is
It's from the ethics and core values of the
perfect. Thank you so much, ma'am. It also connects ethics and values. And why ethics and values are important? Because that is central to the functioning of any organization. Any other inputs? Thank you so much. It's a multidimensional approach. So we are saying multidimensional because occupational health is no longer unidirectional or unidimensional. We don't just talk about physical hazards, we also talk about mental, emotional, and a complete well-being. It also now includes financial well-being, so it's all inclusive. Any other thoughts? I like that. So occupational health is defined as holistic and multidisciplinary approach, and that's why we are talking about this today. Can you move to the slide? Okay. My apologies that this print is not very clearly visible. I think it's the lighting issues. But what I'm going to do is I can share the link of where this has come across. There's a WHO Global Healthy Workplace document, which is a fantastic document, which tells about how do we actually prepare the business case, how do we implement the entire healthy workplace model, and how can we evaluate whether it's working or not. Now, in a nutshell, what this is talking about is what will happen if we are not focusing on health and well-being. The top left talks about unhealthy and unsafe workplace. It also talks about stress. And as we go to the bottom, it talks about what is the effect on absenteeism, increased costs. I won't say business failure, but it will increase the business challenges, definitely. Now, if we invert this, what is organization looking for? What is the CEO of a company looking for? He or she is looking for how are my employees going to be productive? How are they going to create a difference in the future? How can they be energized after every day? It's not that we are exhausted and tomorrow we say, बहुत परेशानियां हैं, बहुत दुख तो जीवन में बहुत सारे हैं, but it is just not because of work. It is also about how can they come up with new ideas by which the work can become much more nice to work on or become much more active and healthier and friendlier. So if we need to start thinking about the change comes at 4 levels. What is there right at the top is leadership. Until and unless we start engaging the leaders, the CEOs, the leaderships, we will not get any changes in the workplace. So the first job of a health professional or a senior leader is to ensure that we are able to make that change in the eyes of the leadership. They are able to start understanding what this is all about. It's just not about occupational health. It's really about business. But if you want to make them understand, start speaking the business language. Sometimes you need to show the numbers. Sometimes you need to also show the metrics. There's a very old saying which says, what gets measured gets done. If you don't measure it, you are unable to catch the attention of a senior leader. So how do you catch the attention? It's related to the leadership, values, the ethics, but more importantly, the business case. The second thing which is integral towards creating a healthy workplace is having a strategy in place. What is the thing which you are going to do? Today you say that we are doing medical examinations. We all do medical examinations, but is medical examination just going to make the difference? The answer is no. We need to think end to end. Health promotion, health prevention, cure, rehabilitation, and more importantly, continual improvement. So it's never about only a single aspect. It's about the integration of all the aspects together. This is what is the strategy, and this is central. The third thing, which sometimes we do a bit less. Any guesses? We are all guilty as health professionals not to do this often. Any guesses? Just checking everyone is awake and no one is having sleeps or hangovers. Okay, so I'm going to say this out. The third thing which we are often guilty of doing less is communication. It's very important that we need to communicate what we are doing, both to the employees, but more importantly to the management. We all do good work, but let's ask ourselves in our hearts, how many of us really make it evident? Dr. Sandeep showed a wonderful presentation where he showed of how the communication is happening not only to the leadership, Mr. Vaidya, but also to the employees. And I think if employees become aware what is available, then only they start utilizing that. Utilization is what is very important and what the management looks at. So the third aspect is communication, and the last aspect is about continual improvement. You need to keep on sharpening the axe and keep on improving. Now, for all of you who have been working even before COVID, you would have realized that the work was at a different pace. And when COVID came in, each of us was asked to step up. The reality was that we got a fantastic recognition and respect during the COVID times. But let's face it, COVID is now waning off. And I think we all, as human beings, love recognition and respect. So how do we get it back? And if we need to get it back, we need to think about sharpening the axe. How do we keep on making things which are much more sharper, interesting, so that the management continually feels that we are relevant as a function? Now, I'll ask one question, simple question to everyone. How many of us love a promotion at our jobs? Me including, everyone? So, for all of those who have gone into these kind of interviews, as today the chairman was saying, or the executive director was saying, what is the thing which has been visible is, what is the kind of leadership vision, what is the kind of proactive self-starter approach, and how do we start making a difference into building a culture all along at the workplace. And in case we want to do that, we need to first tie up these 4 aspects all together. Now, I want to say this proudly that while I've been working with GSK for long years, and today I'm not going to talk about GSK and what it has done, I'll be speaking on that tomorrow, but I also want to acknowledge that I have among us the gentleman, Mr. Gurpreet Singh, who has been fundamental in improving my own understanding and knowledge of how I could become better and effective as a leader, not just an occupational health professional. We all need to, and I just want to kind of appreciate his contributions out here. What's very important is, if we want to grow and if we want to have a promotion, it's never alone and sufficient being an occupational health professional. You need to start evolving as a leader. The leadership mindset is what starts making a difference. So I've given enough of thoughts on what are the central figures, but what I'm going to show in the next slides is how 3 organizations, all of what I've said has got really implemented. And I'm going to invite all of you to please interject me at any time. This needs to be more interactive, then only we can get the learning away. And ask questions. Next slide. Next. So I'm going to begin with a company called Chevron. Chevron is a very famous organization in the petroleum sector. It's quite known for its entire petroleum practices and leadership. But what I'm interested is on the health part of it. Next slide. So we have talked about this model. I'm going to refer to this model again and again. Where I would like to kind of begin with is how Chevron has used the physical work environment, the psychosocial work environment, what they have done in enterprise, what they have done in personal health resources. And the thing which I would like all of us to kind of observe is how these components are really being implemented by them in the workplace. Now, what's going to be very surprising and sometimes interesting is you might already be doing all of these things. It's just of how you represent this in the right way so that it strikes the right note at the leadership level. Next slide. All right. So slide appears to be a bit hazy, I think lighting issues, but this is the first thing which Chevron is doing. They are embedding wellness into the physical work environment. And how do they do it? They have ergonomic policy standards, food, health stations, fitness centers. And I like the last one, making health visible. Now, each of you would ask, Dr. Saab, hum bhi to ye sab karte hain. And I hope we can also understand Hindi, but I'll stick to English. We all do all of these things. What's different? So the answer will be coming towards the end. But what's important out here is they have made a very clear basis of showing how they are working on the physical environment. Next slide. In order to address the psychosocial element, they have been doing 3 things. EAP, Employee Assistance Program. They have been talking about online well-being modules and some resources on stress. Now, what's interesting, for how many of us understand employee assistance programs? Excellent. So employee assistance programs are a wonderful resource of differential programs which can be on counseling, which can be on training, which can also be on some kind of guidance related to life crisis and support. And these are run by professional vendors. For the organizations who have been running it, it has made a huge difference. So EAP is a wonderful program. It paid a lot of credit during the COVID days. The second thing which they are doing is online well-being modules. Now, when I say online and then I say well-being modules, well, in the past, all of us have been doing trainings. What is the difference between training and an online well-being module? The difference out here is This is more at convenience. This can be done at your own pace, whereas formal face-to-face training was always about being there at a designated time, which was not convenient. We are a Gen Z generation. We want everything on the mobiles. So they are now focusing on how we can make it convenient as per your own times. And they have also built up personal resources. Remember the word in the healthy workplace, it talked about personal resources. So the stress resources are personal. Next slide. They've also ensured that they have built up a complete calendar of what they are going to do throughout the year. Now, they have said that first quarter is going to be on health risks. We are going to have the second quarter on self-care. The third quarter is going to focus on musculoskeletal disorders and physical activity, whereas the last one is going to focus on nutrition. Now, what's important out here? I think each of us devise a calendar. It's about communication. It's about making this visible. It's about making this perceptible. It's focused on increasing utilization. It's just not focused on building up a campaign. And what they have done out here is they have put this all very nicely and they are communicating well to the audience. Next slide. Dr. Sandeep talked about a CSR program and what is our responsibility towards the nation. Similarly, Chevron also have done their own work, and this is related to AIDS work which they have been doing. This is not just one of the programs. The key out here is we need to also invest into community-based programs. It can be TB Mukt Indian Oil, it can be partnerships for education, health and so on. But that's very integral to creating the culture change. It's never only about the workplace and us, it's also about the nation, it's also about the community. Next slide. So this is where the management catches attention. As I said earlier, what gets measured gets done. What's very important is we need to start showing what is really changing. Management says, Dr. Saab, you're doing excellent work and everything is happening, but is this really making a difference? And management not only asks for utilization figures, but these days we are also talking about return on investment, value of investment, and it is also translating to the health sector. Now, as health professionals, that's not something which we have been very used to. But what's important is we need to bring up measurables by which we can show that it's really working. Chevron actually talked about healthy eating, emotional training, physical activity challenge. They've also talked about what has happened in different countries. And if we are able to call this out and compare it, that's what starts making the difference. Next slide. As I have reinforced enough, communication is important, and they have been communicating this through something called as Health Matters. So Health Matters is their own internal publication by which they actually take it out to all of the employees of what we are doing. And what's unique out here is it's not about photographs externally, but they actually put up their own employees' photographs, so that brings a sense of pride and passion, not only for the health people but also for the leaders who are actually doing it. Next. All right, so this brings us to what and how they have made a continual improvement. I talked about strategy. This is where they have pulled it all together. Central to their strategy is leadership engagement. It connects to the vision and objectives, the assessment, the planning, the implementation and review. Anything which is going to be measured is going to make a difference. They have something which is called as their well-planned process. They have a scorecard. This scorecard is there for all of the sites across the enterprise, and they are able to measure of how this is making a difference. So what I've showed you through this example of Chevron is how different components are coming in place. How do you use it to your advantage? How do you convince the management, and how do you show continual improvement? I'll take a pause out here for any questions you might be having on the topic till now. Yes.
I think the WHO model which you have shown starts with plan to assess. I think this is the thing which we usually misses. We have a reactive approach most of the time rather than a planned approach.
True.
So you have shown the plan also, the quarterly plans they have done. So I think having a basic plan at the start of the year gives us a good approach. My question, now this was my input. My question is, EAP, you talked about the Chevron is utilizing EAP as well. why India suffers in terms of utilizing EAP despite having a lot of medical issues which are as
Brilliant question. So for anyone who is using EAP, before I answer, anyone wants to actually take up, Raman's question is, why is EAP usage very low out in India?
There's a lot of stigma and that's the most challenging thing that we find. Medication.
That's a great input. So, absolutely. Ma'am talked about stigma, sir talked about lack of awareness.
I believe the counselors would take
That's true.
I would not get myself counseled anything less than a psychiatrist or some clinical psychologist rather than some Jeffrey or Hamad Kumar.
Okay, okay. I have the gentleman at the back.
Many of the times employees themselves are not aware about that it is there within their system because of the load of the other communications related to business which takes more priority over the employee engagement program or assistance program for the well-being program. So that is more or less more important role by utilizing this EAP for
Thank you so much. I think
Health issue, but the people deciding it are not from the health service. Not knowing the people, doctors are not deciding who should be the counseling employees in a generalization.
great input. Yes, ma'am.
Actually, still our scenario, health is always the last thing. Still persistent of health.
The reactive approach.
Yeah. And then people have other things more important than thinking of their health. For doctors, they come only when they are sick or they are severely sick. They are out of the Google approach. They have done everything. Then they come to doctors, and they yet to think that we have such things in our society, in our system. We have to give that awareness to them.
Perfect. So I like the Dr. Google approach because each of us face Dr. Google these days.
And also, I think health is mostly of physical and mental well-being has come after COVID. Nowadays, it's just living. I think for us, health is mostly of physical. Get any disease.
Absolutely right.
Not much focus.
So I'll combine on aspects, whatever I've heard. I think,
For that, Rashish, I have what I have experienced. Why one of the few practical reasons, other than those reasons discussed. First is the communication to the employees. Most of our large corporate population resides in the factories.
yeah,
Corporate people are aware there is a EAP, but factory people are not actually aware there is a EAP. So
Yeah.
there's a communication gap.
yeah,
Worker who is illiterate he should know there is a EAP service. Then comes the language barrier. India is a diverse country. North speaks Punjabi, the South don't speak Hindi. So the EAP services sometimes they have only English and Hindi, no Punjabi, no other language.
yeah.
Large ones have multiple. These are other two practical reasons why it is multiple.
So I'll summarize what I've heard. Awareness, stigma, understanding of the people, utilization, language issues. But let me throw you the bigger challenge. The bigger challenge is, today, if you have a concern, who do you go and speak to? Do you speak to your family or do you speak to an anonymous person? अगर आपके यहाँ कभी कोई परेशानी होती है कि आप काम पे मुसीबत में हैं एंड कभी कोई और तकलीफ़ हो रही है, तो हम किसके साथ ज़्यादा कंफर्टेबल महसूस करते हैं? हम अपने परिवार वालों को बताते हैं या हम किसी ऐसे व्यक्ति को जिसको हम जानते नहीं हैं? So I hear family as a lot one. Some people say anonymous, but this is also cultural thing, especially in the emerging countries. This is just not for India, but even for countries like China and many other countries. It's about the comfort factor, and I think this takes a bit of time. Because what we are trying to, if we scratch this, the key issue is confidence and trust. And until we start building the trust, until people start feeling कि जो भी मैं बोल रहा हूँ वो किसी और के पास नहीं जाने वाला, मैनेजमेंट सुन नहीं रहा है, ये मेरी वन-on-one प्रिविलेज इन्फॉर्मेशन है और ये कहीं डिस्क्लोज नहीं होगी. जब ट्रस्ट बिल्डअप होता है, then only we start getting the confidence into the process. So if I kind of bring this back, while we have a lot of peripheral challenges, as Dr. Raman has said, but one of the key things which we need to start building up is trust in the system. Health can only undergo a significant change if people become proactive. And for becoming proactive, you need health promotion and prevention. What ma'am said is people come because they are now looking at curative and rehabilitative aspects. So until we start shifting the needle, which we'll start seeing in the next organization, which I'm going to talk about. Sure.
Which was my confusion. When you say EAP, how are you defining it? Because I heard the group,
Yeah.
I heard mental health.
Yeah.
So mental assistance I get, but are we talking about an EAP on here? Because that clearly Chevron has done.
Yeah, so employee assistance program is quite a wide range of programs which is being offered by several vendors. One of the most prominent ones in India is Optum, and they offer a service which includes aspects on physical health, mental health, emotional health. They also talk about interpersonal relationships. So the gamut is quite wide, and it's just not limited to a certain aspect. I think it's so much that they can even come at the workplace and offer trainings on designated aspects which you want to talk about. They also cover financial well-being these days. So I can speak for an hour on what all it includes, but I'll be happy to connect offline and share more on what this is about. Sure, sure.
We've heard of them, and
Yeah.
we ourselves have been studying this business for a really long time, but we will finish.
Sure, sure. Perfect. Next slide, please. So now I'm going to cover a company called Johnson & Johnson. I think most of us would have heard of Johnson & Johnson. We would have used their products and something like a Band-Aid, Handyblast, and so many things. Johnson & Johnson has been in India for a long time. But what I'm going to talk about is their global practice of how they have created a culture of health and well-being. Next. Now this gentleman out here is the Chief Executive Officer of Johnson & Johnson. Health and well-being works right from the front in Johnson & Johnson because the CEO embodies the fact that health and well-being is important. He says it's an investment, not a cost. And why does he say so? Because you're not able to see the benefits of health and well-being in a very short-term basis. You cannot quantify this that tomorrow you're going to see a change in the organization. It's a long-term investment, and it brings about immense changes in the health promotion and preventive side, ultimately leading to the cost benefits as well. So they are very clear right at the leadership that we are doing health and well-being related investments. It's not a debit. It is ultimately going to be a credit in their balance sheets going forward. Health and well-being starts from the top at Johnson & Johnson. Next slide. Now, in order to ensure that it comes from top down, they have a very clear articulated strategy. Johnson & Johnson has their values which are known as Credo, and within the Credo, health and well-being is a very important thing. For them, it's about do good and be well. If they're going to do good for not only their employees, it's also going to emanate to the families, to the community, and ultimately the well-being is going to come across. So they have now incorporated the focus on health and well-being as a very different strategic business enabler, which is not only causing an internal kind of a buzz within the organization, but they have now extended what they are doing as good practices even to industries beyond Johnson & Johnson. We'll come to that. Next slide. Now, I was talking about strategy when I began. I said leadership, strategy, I talked about communication and continual improvement. This is the central part of what was the Johnson & Johnson health and well-being strategy. Now, Johnson & Johnson has 5 elements which they consider important on health: leadership and commitment, enterprise-wise programs, policies, procedures, engagement and participation, measurement and outcomes. Now, the difference which you will see from Chevron to Johnson & Johnson is we are breaking down what we had talked about as healthy workplace. We heard about the model. The Chevron example showed how the different aspects, physical, psychosocial, community are connecting. This is about breaking it down into how it's really done. Now, please do bear in mind that all of the things which I have used out here are there in the public domain. This entire thing might be a bit dated, and hence Johnson & Johnson is completely at will to refresh, and they might be having something newer. My point out here is to actually educate on what goes behind the process. Next slide. Once they had built up a strategy, then comes delivery. How do you deliver health and well-being right at the shop floor level? Dr. Aman talked about workers are there in the factories who are working continuously out here. How do we take health right to the last level? They have built up aspects on what is going to be on mental health and well-being, and as you can see, employee assistance programs, telephonic counseling, digital health coaching, yoga, meditation, mental well-being booklet. They have lifestyle programs which are out there. They are having health education and awareness, and they are also having occupational health and disease management. Now, for all of us who have heard the WHO definition of health, anyone wants to describe that? The WHO definition of health, what is health? Perfect. Disease and infirmity. Thank you so much. I'm sure Mr. Park would be very happy hearing us that we have read nicely on the PSM and we remember what he had said in the books. So my purpose of bringing this out to the fore was, it talked about physical, it talked about mental, it talked about psychosocial, it also talked about not the absence of disease or infirmity. Why I'm saying out here this is important is, if you have a look, they have talked about mental well-being, they have talked about lifestyle. Each of us would agree that the biggest challenges which we are having is around non-communicable disease these days. Hypertension, diabetes, hypothyroidism, hyperlipidemia, these are the ones which each of us are grappling. So they have a healthy lifestyle program. They then are going to health promotion, which is right at the starting of the spectrum. They are doing a lot of work on health education and awareness, and they also have a structured occupational health unit. So if you want to imagine how a good service should be, this is a great example of how the delivery needs to look at. This is what they call Live for Life. Next. And they have been having a lot of health programs. So I think to give credit just not to Johnson & Johnson, but we have Hindustan Unilever out here, we have Rio Tinto out here today. I think a lot of organizations are actually having a multitude of programs. I know that Dr. Sandeep has spoken about some of this, and we'll have Dr. Shriniket and Dr. Andrew also talking about many of these. I'm not going to describe them, but what I want to say is the previous two slides focused on strategy and delivery. This is talking about list. Often we show the list, but we don't talk about the strategy and delivery in a comprehensive manner. Next. So health can just not remain health till we become innovative. And what Johnson & Johnson does is, it starts to kind of work with external partners as well in order to keep innovative practices happening. They have an internal institute called as Human Performance Institute, which does several interventions and programs like Energy for Performance, Corporate Athlete Program. This is to create an exciting buzz of how we can become to the next level. Whatever studies have been done in research with the athletes, they have brought it to the corporate world and they are implementing it not only internally but even externally. GSK also has worked with Johnson & Johnson and these institutes in the past, and believe me, it's a fantastic program. I know some of us have attended it out here, but I'll say that this is one of the flagship programs which has made a difference. So they have a replicable model, they have resources, they have scientific tools. When you put the complete structure in place, this is what starts bringing the difference. Not just in the thinking of the employees, the management, but also in our own sense. We feel more confident because we have a complete array of what we are delivering. Next. Apologies for the smaller print, but again, this is breaking down each of the measurables into aspects. As you see, it's also color coded, so each of us understands the rack system well, red, amber and green. So they have used those colors to their advantage, what is working, what is not working, how do they improve it going forward. The third organization which I'm going to touch upon today is Cognizante. And I can bet that not many of you would have heard of Cognizante. Anyone has heard about Cognizante in the past? No. So this is a digital IT firm which focuses on digital health. This is a US based firm and they have been doing some fantastic work on their core subject, which is IT and the IT's focus and innovation for health. But what I'm going to talk is how they have really made a difference on the health and well-being side. So now, by now, I think all of us now remember the model. On the right side, you see the WHO model. On the left side, how they have connected the WHO model. So as I go forward and as I end, I'll feel more happy if we are able to now get the connection between the WHO model and what needs to be done at the workplace. So instead of speaking this out, in the next few slides, I'm going to show you how the physical, mental, environmental, enterprise-wide and socio-economic has made a difference. Next slide. I think now we are all clear on how physical well-being makes a difference. They have had initiatives around preventive wellness, fitness, eating, and so on. They have also made up tips which are available to the employees of how they can make a difference. Next. On the mental health, and ma'am, again, it's EAP, which has been used by several organizations. They have EAP, they have leadership training, they have mindfulness apps, they have webinars which are out there, and they're also having lots and lots of support, which it's through insurance or others. Next slide. Now, here's where it becomes interesting. Now, for all of us, you'll say, how does environmental safety have a role to play in health? So, I think environmental safety is equally important because health and well-being is integrated together with EHS. I don't see it isolated. It's a part of the bigger option and the role. On one hand, we are connected to EHS. On the other hand, we are connected to HR. We lie somewhere in between because it works end to end. And what they have done is, they have also talked about indoor air quality, how that starts affecting our own performance. They've also done ergonomic evaluation of the setups. And in COVID-19, each one of us, including them, have done a lot of work. So they're using technology at the best by using apps which help you to monitor your habits and your own performance going forward. Next slide. An example of enterprise-wide, what they have done for the enterprise or the community around there. It talks about connecting with veterans, connecting with people with disabilities, also having STEM-related programs out there. Next slide. On the socio-economic aspect, they have also done things which are on financial wellness. As I was saying, well-being does not limit ourselves only to the physical, mental, emotional. It's also about financial, because each of us, if we are not having enough of salary and enough of money out at homes, I think it brings its own stress to each of us. So they have also looked at this. Rally is one of the programs which also talks about health risk appraisals. They also talk about how we can use the physical movement to improve aspects of health and well-being in there. Next slide. And this slide is ultimately focusing on their core kind of strategy of and how do they measure it. So the center lies the stakeholder. The stakeholder is just not the leader, it's also the employees. It's also different people right from facilities. So admin has a great role to play. You have quality people who are important, you have leadership, you have employees, you have HR, but you also have employee engagement as a group which can make a difference. So it's up to us on who we feel are the key stakeholders. What I like about here is they have put stakeholder as the central, and for organizations which listen to their stakeholders, including their employees, I think that's where the culture of health and well-being is most sustainable and permanent. So this brings us back to the model. I hope I was able to capture your attention on how this really works by using these three examples. Next slide. And this is a kind of a data which talks about if we do health and well-being at workplace, then the future is definitely bright. It brings about a lot of changes. I would encourage each of you to start thinking across of what you can improve across. Each of us is a leader in our own sense, and together we can make a difference. Thank you. Open for any questions or feedback. Yes?
So in your experience, where do you think they have the biggest hindrance? I'm sure they can teach where they are today.
Yeah.
In their journey, where do you think they had the biggest hindrance? What was the...
So which one are you talking about?
I want that the first one which we did, Chevron.
Chevron, okay.
Because they reached a really long way.
Yeah.
They're encompassing everything.
Well, I shouldn't speak for Chevron because it won't be appropriate, but I'm speaking on my perception, and I'll just comment to that. I think one of the biggest challenges, if you ask for any industry, including Chevron, is about utilization. Until and unless we have a 30%, minimum 30% utilization, the culture-related change only starts beginning once you have had the quantum of 30 to 50% of the people getting involved in utilizing it. So even if I comment for GSK, where I belong to, I think that is where we are working the most. Getting the utilization, understanding the difference of what strikes the mentality of a young person who's 25 to 35 vis-a-vis someone as a supply chain worker who's at the age of 55. I think getting that dynamics right is the biggest challenge. We are still working on it. I'm sure Chevron is also working on it. Yeah, gentleman at the back. Well, that's a tricky one. I think I would rather say that this is an organization call, because every organization has a very different way. In the place where I have worked, which is GlaxoSmithKline, we have had health and well-being integrated with EHS, and it has worked fantastic. But I've also seen organizations where health is a part of HR, and they are doing amazing. So maybe I'll not give that view about what's an ideal scenario. But to me, what's ideal is effectiveness. How does the delivery happen? How do we kind of make that work? So I think it's important that whenever, whatever, and wherever we build the policy, the connection needs to be clear at the top. Management needs to own, whether it's a EHS, whether it's a HR, whether it's a health policy. If the management is not owning it, that does not help. And in the last, the workers need to feel confident that whatever is said in the policy is really going to get implemented. Otherwise, it's not going to work.
Thank you, Dr. Ashish.
Yes.
I'd like to ask you one thing about, do you have any example in Indian government policy outside?
I like your question. I'll just like to say that I'm an Indian through and through. I've worked in India for long enough. I've implemented all of this. But at the same time, what you have on stage are some excellent people from India, Hero MotoCorp, Dr. Sriniket, Dr. Sandeep, Indian Oil Corporation, who have implemented this in India, and it works. So believe me, it works. It's just that you need to think it very solidly, smartly, and then make the difference. It's a journey. It will not happen next day. Thank you so much. I have Dr. Sriniket now. I will be outside for any questions further. Thank you so much.
Thank you so much, Dr. Ashish. Thank you. Our next speaker is Dr. Sriniket Mishra, who is an occupational health and wellness physician having over 22 years of experience in medical practice. Presently working with Hero MotoCorp Limited India, world largest two-wheeler manufacturer, as a chief medical officer of organization and based in New Delhi, India. Good exposure and experience in field of corporate health and wellness management, preventive health care system, management of medical emergencies, occupational health risk assessment, industrial hygiene management, ISO 45000 OHSAS 18001 standards, statutory compliances, and other occupational health system audits. His expertise in management of all aspects of occupational health services, organizational wellness management, management and prevention of occupational diseases, innovations at workplace for improving employees' wellness, injuries and trauma management, first aid and CPR training, ergonomics evaluation, disaster preparedness planning, EAP, employees assistance program management, mental health, and managing medical CSR activities, etc. Certified in ATLS, ACLS, NAB, OSH, IGC. Indian Achievers Award in recognition of outstanding professional achievement and contribution in nation building. CEO Insights magazine for 10 best chief medical officers in India 2020. Winner of Western Region AIMA HR quiz competition and finished 4th in national finals in 2015. So Dr. Sriniket Mishra.
Thank you, Dr. Manju, for introduction. Namaste, good morning everyone, and welcome to ACUCON and for this workshop. As introduced by Dr. Manju, my name is Dr. Sriniket Mishra. I am working with Hero MotoCorp as Chief Medical Officer of the organization. And I will be sharing in brief how you can adopt this model in your organization. So Dr. Sandeep and Dr. Ashish have deliberated on almost all the aspects. So I will be sharing how we can make our programs and policies as per this WHO model framework. In 2019, we applied for this. There is one organization who is conducting annual awards for the Global Healthy Workplace, and in 2019, we applied for this. And in Melbourne, we qualified for the finals. Out of the 3 finalists, our organization, which is the first Indian organization which won this Global Healthy Workplace Award. Before applying this award, so we studied what are the requirements for this award and how we can adopt this WHO Healthy Workplace model. So their assessment is based on this WHO Healthy Workplace model only. So we reviewed all our programs and policies, and we found that we are doing everything, but we have to fit all these activities into this WHO framework. So we put all these policies and programs in this framework, and then we made our presentations and application accordingly. So that was the case for our winning this award. So I will be sharing why this WHO workplace model is required and why we should adopt this. So Dr. Maria Neira, Director, Department of Public Health and Environment of WHO, she quoted that the wealth of business is best founded on the health of its workers. So, and in 2007, World Health Assembly of the WHO organization endorsed the Global Plan for Action on Workers' Health, with the aim to provide new impetus for action of member states. This is based on the 1996 World Health Assembly Global Strategy on Occupational Health for All. So before this, WHO was not much focusing on occupational health. Their main focus was on public health and other disease preventions. Also, the ILO Promotional Framework of Occupational Health and Safety Convention in 2006 and Bangkok Charter for Health Promotion in a global world provide importance to points of orientation. So this global plan of action set out 5 objectives. First, to devise and implement policy instrument on workers' health, to protect and promote health at the workplace, to promote the performance of and access to the occupational health services, to provide and communicate evidence for action and practice, and to incorporate workers' health into other policies. So, and this is the definition of healthy workplace by WHO. So a healthy workplace is one in which workers and managers collaborate to use a continual improvement process to protect and promote the health, safety, and well-being of workers and sustainability of the workplace by considering the following based on identified needs: health safety concerns in the physical work environment, health safety and well-being concern in psychosocial work environment, including organization of work and workplace culture, personal health resources in workplace, and ways of participating in the community to improve the health of workers, their families, and other members of the community. This is the definition by WHO. So in this context, WHO model provides a flexible work frame adaptable to diverse countries. So it is not based on a single European model or some country model. It includes all the diverse countries, workplaces, and cultures. So this is a very flexible model. WHO will develop a practical guidance specific to sectors, enterprises, countries, and cultures, together with WHO collaborators, experts, and stakeholders. So a committee was formed, and then they proposed this model, and then a document was made. This is available on WHO website. So already shared by the previous speakers. So this is the framework of WHO Healthy Workplace. The physical work environment. So my company is one of the, like, we are largest two-wheeler manufacturer since last 21 years. This is a manufacturing unit. We have 6 manufacturing plants in India, 2 outside India, and one big R&D center. So earlier, like, occupational health was considered just for the compliance purpose, factory that compliances and other things. Slowly, importance of mental health was recognized, but currently we are talking about holistic health, holistic wellness, that is well-being. That includes physical, mental, and psychosocial. Psychosocial health is also very, very important for employees' health, because these things, mental health and psychosocial health, these affect our physical health. Like somebody is having stress and other issues, mental health issues, or his workplace is not having considering his psychosocial issues, then that will result in physical health issues like hypertension, diabetes, or cardiac diseases, other lifestyle diseases may occur. So all these things are very much important. So for physical health and environment in a manufacturing unit, I will just say that we should consider the overall hygiene of the place, industrial hygiene, ergonomics, lighting, air quality. So all should be within the minimum level and within the permissible limits. Like we have limits in the factory that for all the chemicals in the air should be dust, fumes, all these things should be controlled, and this should be minimum. We should have hierarchy of controls, like substitution, elimination, administrative control, PPE, and then medical surveillance. So for controlling the hazards, we should have HERA, hazard risk assessment. And then there should be regular workplace monitoring to control the noise level, dust level, and everything. And so provide a good hygienic workplace for all the employees. There should be hygienic rest places, hygienic areas, like hygienic canteen food, and good nutritious and healthy food for the employees. Second thing is personal health resources. So an organization can provide various health resources for the employees, like physical health resources at the workplace, gymnasium, or we have occupational health center where various tools are and machines are there to assess their health. Nowadays we can provide the digital health resources through, there are many health apps through various service providers like fitness app or online health consultation apps. So these resources we can provide. As a organization, it is our responsibility to provide the resources to the employees. But the health is a personal matter. So employees should also take charge of their own health. It is their responsibility, not organization responsibility. As an organization, we should provide everything which can support their physical, mental health. We should also encourage our employees to involve in community health involvement services. In my organization, we are providing special leaves for volunteering services, either in the company CSR events or in any other CSR event they can participate. We have a policy for that. Psychosocial work environment I will be discussing in detail. But the base of all this framework, like other speakers said, ethics and values. If you are having many programs and policies, but you are not honest about this is just written in the documents and are not implementing it honestly, then employees are not going to be benefited from this, and you are creating a fake model. So leadership engagement and worker involvement. Workers should know what is being done for our health services, because in many organizations there are many things written in the documents, but workers, employees are not aware about anything. So worker involvement is very necessary. We should consider what is the need of the worker. There should be surveys and feedbacks. Accordingly, the programs should be divided. And there is a PDCA model. Everything we are doing, we should plan, do, evaluate, improve, mobilize, assemble, assess, and prioritize. So this is the framework. we can put all our programs and policy in this framework. Whatever most of the companies are doing everything, physical health, mental health, and psychosocial policies from the HR. So we can put all these things in this framework. And if somebody is not having, they can start including this. So why we need a global framework? I already said that given the ethical, business, and legal reasons for creating healthy workplaces, a look at the global situation reveals that many, possibly most enterprises don't know how to create this healthy workplace. So that's why this model was created, to assist the organizations for creating this healthy workplace. It is important not only to the individual workers and their families, but also to the productivity, competitiveness, and sustainability of the organization, and thus to national economy and countries, and ultimately to global economy. So now I will talk about well-being. So definition of well-being is the experience of health, happiness, and prosperity. It includes having good physical and mental health, high life satisfaction, a sense of meaning or purpose, and ability to manage stress. So not only physical health, for well-being, all these things are important. Workplace well-being relates to all aspects of working life, from the quality and safety of the physical environment to how people feel about their work and their working environment, the climate at the work and the work organization. It is universally accepted that human beings' basic need of a state of well-being are good physical and mental health, peace, equality, shelter, food, income, sustainable resources, and social justice. So all these are components of total holistic well-being. So, and we should consider all these things in our programs and policies. The organizations should address requirements for creating an environment and for instilling a sense of well-being among employees through various policies and programs. And there is a strong connection between the health and well-being of the people and their work environments. When people feel valued, respected, and satisfied in their jobs, and work is in safe, healthy environments, they are more likely to be more productive and committed to their work. Everyone can benefit from a healthy workplace. So like Dr. Ashish was saying, that the organizations want the return on investment. So this is the return on investment, because if we focus on the health and well-being of the employees, they are more productive. And if they are more productive, then definitely organization is going to be benefited. There are various studies and data suggest that if you are putting some X amount in the health and wellness of the employees, you are getting 3 to 4 times returns. So it is a business case, it makes sense to invest. Like Johnson & Johnson CEO was saying that it is good to invest, it is an investment, not a cost. So I will be sharing now a sample health and wellness policy for for any organization. It should describe its commitment to protect and promote employees' health and well-being. And for any policy, we should have, you should define aims and objective for that policy. Or not, if you don't want to say it policy, you can say wellness, health and wellness guidelines. So I will be suggesting that to promote employees' access to various wellness resources for maintaining and improving their physical, mental, occupational, spiritual, and psychosocial health, leading to holistic well-being. To promote and protect health of the employees for supporting their performance and productivity. To comply with all legal and statutory requirements related to health and wellness of the employees. And to reduce employee sickness, sickness absenteeism, reduce presenteeism, reduce employees' personal health care costs, reduce organizational health care costs, increase productivity and overall profitability of the organization, provide health care assistance to employees, dependent and community, and contribute towards making a healthy and fit society. So this last line, if we are doing all these things, then definitely organization is going to be benefited and the return on investment will be much more. So a policy elements I will say a few points. The guiding principles of the well-being policy should be a combination of organization health and safety policy, local legislation, global best practices of health and wellness, and WHO healthy workplace model. So all these can be combined in this global WHO healthy workplace model. And how we can make our policy? The organization-wide health and wellness policy incorporating local legislation and universal best practices. All programs and policies to be based on health risk assessment, identified needs, expectations, and preferences of the employee justified by evidence from health and wellness data through various surveys, studies, and health screening, examination data, etc. So like Dr. Ashish was saying that everything should be which is measurable, which is manageable. So जब आप measure करेंगे अपने health and wellness program के outcomes को, then only we can manage better, and we can show our management that these are the benefits which are helping the employees being fitter, healthier, and which is resulting in the benefit to the organization. Wellness policies should also take into consideration of diversity, gender, especially abled employees. सारे लोगों के लिए एक ही प्रोग्राम पॉलिसी नहीं हो सकती. We should consider all the demographics. Suppose some pan-India company there which is having their offices and plants in various states. So we should consider the local people, demography, age gap होता है. Younger people wants different resources. Younger people wants more digital health resources. Older people are not very comfortable with digital things. They want physical health resources. फीमेल्स के लिए अलग कुछ स्पेशल पॉलिसीज होनी चाहिए, स्पेशली एबल्ड एम्प्लॉयज़ के लिए कुछ अलग होना चाहिए. तो वी शुड कंसिडर ऑल दीज थिंग्स. नॉट एक ही पॉलिसी सबके लिए फिट नहीं होगी. प्रोग्राम्स जो होते हैं सबकी नीड को देखते हुए आपको डिज़ाइन करने चाहिए. देयर शुड बी विजिबल कमिटमेंट एंड पार्टिसिपेशन फ्रॉम द ऑर्गेनाइजेशन लीडरशिप. अगर लीडरशिप का पार्टिसिपेशन और इन्वॉल्वमेंट नहीं है, देन कोई भी आपका प्रोग्राम सक्सेसफुल नहीं हो सकता. Because when leadership is convinced, they will give you finances, resources, everything, and then only you can implement your programs. और कैसे convince करना है? Dr. Sandeep already spoken that how we can convince our management to invest in these wellness programs. Health and wellness programs impact and outcomes should be measurable and manageable with a proper review to adopt and implement as per the qualitative and quantitative feedback. Working with a proactive approach and collaborating internally, externally with all relevant stakeholders. All wellness programs should be periodically reviewed for effectiveness, continual improvements, and innovation. Employee participation and suggestions should be encouraged. So I'll be just finishing my thing. We can divide all health wellness programs in 3 sections: physical health management, mental health management, and psychosocial health management. Then we can further divide the physical health in 3 sections: preventive health programs and health protection program and health promotion programs. So now the importance of mental health is much more. So this is one of the main focus areas in most of the organization now, especially the non-manufacturing areas like IT industry, other industries, where the physical health issues are not more, where mental issues are more. So organization should have a visible commitment, policies and programs to support employees in protecting their mental health and well-being by providing suitable resources, help in prevention of mental health issues, and support for the improvement of mental and psychosocial health. This is some data that in India, almost 54% of employees suffer from mental health issues. So last is psychosocial health. So for some, like the definition of well-being I discussed earlier, so all these things which are related, most of the things are related to our organizations and HR policies. So these also affect our health. The policies and programs for providing work-life balance, time management, work organization, and stress prevention, policies to promote fun at work, fairness and transparency in processes, opportunities for career progression, flexible work policies, work time, generous leave policies, eliminating of psychosocial risk factors like violence at workplace. Then there is POSH, prevention of sexual harassment at the workplace. Then volunteering policies for helping in the community services, communication and awareness session on personal health related topics, training about stress management, time management, work-life balance, employee participation in the decisions that concern them, like job analysis, new expansions, development, etc. And the practices related to recognition and job satisfaction. There are many support performance tasks like on-job training, training programs, work instructions, etc. There should be some financial assistance policies like emergency loan, home loan, education loan, marriage loan. EAP program we have already discussed. EAP is mainly related to mental health, but EAP service providers are also providing other related services, like we have a partner for EAP services. And the most important thing for this EAP is that mental health employees want confidentiality. They don't want their employer to know that they are suffering from any mental health issue. So we discussed this and we found that if we are arranging any psychologist or psychological counseling services at the workplace, nobody will be coming that because they think that the people will know that I have a mental health issue and there is a stigma around that. So we have a partner which is providing confidential this EAP services where the counseling services are available for all the issues related to related to workplace, family issues, marital issues, financial issues, legal issues. So they are covering all those aspects. Apart from that, they are also providing other health related services like diet and nutrition, counseling, etc. So with that, I will conclude my talk and I am happy to answer any questions you can discuss for creating the healthy workplace model at WHO. Thank you. Yes. EAP service के लिए पूछना Okay.
So, in my view, EAP is to assist the employee in health. So, when you restrict it to mental health, then I'm having a.
Okay, so when EAP started, the focus was mainly on mental health. So, अभी EAP को mental health के साथ ही जोड़ के देखते हैं. Yeah. यूसेज का डेटा तो मैं अभी नहीं शेयर कर पाऊँगा, बट वी ट्राई टू जितने लोगों को इन्वॉल्वमेंट बढ़ाना है उसके लिए हम लोग वी कीप ऑन ट्राइंग आवर टीम. वी टेक टारगेट्स फॉर दैट कि हमको यूटिलाइजेशन अभी इस साल इतना है, नेक्स्ट ईयर हमको इतना इंक्रीज़ करना है. तो वो हर प्रोग्राम्स के लिए हम लोग ये चाहते हैं कि इन्वॉल्वमेंट मैक्सिमम हो. फॉर दैट वी डू कम्युनिकेशंस, वी इन्वॉल्व द जहाँ पर हमारे यूनियन के लोग हैं, employee union, so we involve them also to encourage participation in our various activities. For white collar employees, we have email communication, so regular email communication we provide them. And we used to organize various contests on different topics on year-wise. We make calendars for contests so that employees are encouraged to participate in fitness event, and then we reward them with some monetary benefits also, and then recognition is also there. Their names are circulated all over the organization that these are people participated in this event and they are the winners, to encourage others also that they can also choose that. अब जैसे हम लोग कभी कभी वेट लॉस प्रोग्राम करते हैं बिगेस्ट लूज़र के नाम से, तो जो सबसे ज़्यादा वेट लॉस करता है उसको रिवार्ड करते हैं, तो देन अदर पीपल ऑल्सो गेट इनकरेजमेंट दैट इसने 10 किलो किया तो मैं भी कर सकता हूँ. तो दीज थिंग एज ऑर्गेनाइजेशन वी कैन प्रोवाइड देम, बट किसी को आप फोर्स नहीं कर सकते कि ऑर्गेनाइजेशन आपको मैं हेल्दी बना के रहूँगा, आप कैसे बना दोगे आप उसको. तो डायबिटीज़ किसी को है अनकंट्रोल है, यू कैन प्रोवाइड द रिसोर्सेज एज अ वर्क प्लेस, डाइटिशियन को बुला सकते हैं, स्पेशलिस्ट को बुला सकते हैं, बट इट इज़ देयर रिस्पॉन्सिबिलिटी दैट वो HB1AC को कितना कंट्रोल करना चाहता है अपना. तो ओके, थैंक यू वेरी मच. हम लोग इसमें ना BMI 25 के ऊपर के लोगों को ही अलाउ करते हैं, उससे कम तो सब फिट हैं, और इसको हम लोग परसेंटेज में लेते हैं. मतलब किसी का वेट अगर 80 है और 88 है, 80 कर लिया तो 8 किलो कम किया, तो उसको हम लोग परसेंटेज वाइज निकालते हैं कि नॉट इन नंबर KG, उसको कितने % उसने लॉस किया, तो उसको हम लोग विनर डिसाइड करते हैं उस तरह से. नहीं, ये तो एक अलग बीच बीच में कॉन्टेस्ट चलाते हैं कि ये हमारा टाइमलाइन है, इस डेट को आप रजिस्टर करो, 2 महीने का टाइमलाइन है, इस डेट को हम फाइनल असेसमेंट करेंगे और देन वी विल डिसाइड. इस पीरियड में हमको सपोर्ट करते हैं वेट लॉस में. तो सपोर्ट में वेरियस अवेयरनेस मेल्स जाती हैं कैसे वेट लॉस आपको कर सकते हैं, और देन इन हाउस वी प्रोवाइड डाइटिशियन कंसल्टेशन, व्हाट काइंड ऑफ डाइट यू शुड हैव, और even अगर somebody is having some other issues, then we keep on doing regular specialist consultation through our panel hospitals. So that is a free of cost service, and workplace पे ही specialist, orthopedician, neurologist, cardiologist सभी लोग available होते हैं, and they can take consultation. हाँ, response is very good. हाँ, हमारे वजह से क्या होता है कि ये ऑर्गेनाइजेशन वाइड एक इवेंट होता है, और फिर मैन्युफैक्चरिंग यूनिट में हमारे जो अपनी टीम होती है, मेडिकल टीम, वो अपने अपने यूनिट में अलग अलग करती है, तो उसको वो लोग मेजर करते हैं कितना पार्टिसिपेशन हो रहा है, क्या हो रहा है. यस. Yeah.
Individual is saturated with the type of work which is assigned. So I guess in today's world, it is an important challenge for the organization to see that an individual is creatively employed in the task assigned, and there should be some escalation of creativity or innovation in his whatever the task assigned.
Yes.
I wonder how we look at this aspect of.
Yes, thank you. Very relevant question. So, like I said, that organization has a responsibility for their employees कि उनको job satisfaction हो, and there is a thing called job rotation. So, when an employee is in a particular job for more than 4 or 5 years, तो there are no new challenges for him, and then sometimes he gets frustrated, कोई नए ideas नहीं होते, नए challenges नहीं होते हैं. So it is very important to have a job rotation, or speaking with the employee कि what is his need, if he can take some other challenges. So this discussion is very much required. कई लोगों को कैरियर प्रोग्रेशन का आइडिया नहीं होता है कि नाउ आई एम दिस जॉब, अब मेरा कुछ नया चैलेंज नहीं आता है, कोई उनको एन्जॉयमेंट नहीं है, कुछ नहीं है, तो उनको फिर करियर प्रोग्रेशन के लिए अपॉर्चुनिटीज़ देनी चाहिए, या फिर उनसे डिस्कशन करना चाहिए कि इफ़ दे कैन टेक न्यू चैलेंजेस. लाइक अब इन केस ऑफ आवर मेडिकल ऑफिसर्स ऑल्सो, दे आर डूइंग द सेम थिंग्स फॉर मेनी ईयर्स, सो दे कैन डिस्कस विद HR एंड टेक सम एडिशनल रिस्पॉन्सिबिलिटी फॉर देयर करियर इन्हांसमेंट. उनका ऑर्गेनाइजेशन में थोड़ा रोल भी बढ़ेगा, एंड दे कैन गेट प्रमोशंस ऑल्सो. So apart from this medical health and health management, they can take some additional HR roles also if they want.
I think much is required to be worked on this at the organizational level, because we are people
Yeah.
Because of this non-satisfaction with the job profile which is being continued. Although it has been discussed, you all know about the job rotation, we discussed about the HR discussion of the issues. That individual is being kicked out. If we pursue, look, okay, I am not able to perform my task in the way I want to do, I want to do something else.
Yes.
Rather kicked off. Okay, you're not required in the organization. Somebody else will replace you. So better policy should be existing or should be made in this regard.
Yeah, many people get into depression. I have seen a few cases in my organization also due to these things. So thank you. Thank you.
Thank you, Dr. Mishra. And now I'll invite the next speaker. Now I'll invite Dr. Andrew Tay. Dr. Andrew Tay is currently the Director and Head of the Health and Wellbeing Team, HWB, which sits under the Office of the President to drive the university health and well-being strategy. Dr. Tay possesses a wealth of experience working in the tech and pharma industries in the employee benefits and well-being space. He served as the regional benefits consultant for Facebook, where he oversees physical and mental health benefit design in Asia Pacific, and was the director for health and well-being in GSK, who led the company's occupational health services and strategies to enhance health and well-being of employees in Singapore and APAC. Dr. Tay is a graduate from the Yong Lu Lin School of Medicine. He also holds a Master of Public Health, Occupational and Environmental Health specialization from NUS and a graduate certificate in Human Resource from SMU. During the period of his medical specialization, he received his postgraduate public health and occupational medicine training at the Saw Swee Hock School of Public Policy, Ministry of Manpower, Ministry of Health, and the Restructured Hospital. In his free time, Andrew enjoys playing bass guitar in a live band and mixing his cocktails at home. So over to you, Dr. Andrews.
Thank you. So mixing cocktails, playing in the band, that's something about work-life balance, right? And that's exactly, I think, we all should strive to do. Now, we are all occupational health professionals here. I must say that it is a pleasure to be back in India again after the COVID period. The last time I was in India was 2019, and every time I come to India, it has always been hot India. And this is my first time, it's cold India, and I love the weather. I really, really love the weather. Unfortunately, my stay over here will be very short. Tomorrow night, I need to fly back to Singapore for work and other commitments. But it is a pleasure to actually share our experience in terms of what NUS is. Now, National University of Singapore, or NUS, is one of the top universities in Singapore, and this speaker profile is something that you all have seen just now. Now, in terms of ranking, where are we in terms of NUS ranking? We are third in Asia, and we are 19th globally in the THE ranking, which is the Times Higher Education. In the QS ranking, we are first in Asia, and then 11th globally. So it all depends in terms of what are the objectives and the items that we are being ranked. So that's the profile of NUS, one of the top universities in the world. Under the university, there is also this unit known as Health and Wellbeing, which we place it under Office of the President. Health and Wellbeing is not under HR, it is not under Health and Safety, it is under Office of the President, which is equivalent of the CEO office. Now, that's our burden. We care for 13,000 staff and 45,000 students across more than 115 departments, and that is the challenge. So for all of us, whenever you set up a health and well-being office or a meeting, you always need to set up with a mission in mind. And the mission, if you want to actually adopt from anywhere, can adopt from the WHO Mental Health and Wellbeing definition, which at this point of time is to facilitate the complete state of well-being among the people, where you can cope with the stresses of life, where you can be productive and make meaningful contributions to our communities. But health and well-being is so big. You need to know how to be systematic in the approach, and therefore you need to prioritize. And to prioritize, you also need to know whether you want to go into physical health or mental health. During the COVID period of time, we decided that mental health was the greater emergency that was happening because of social isolation and COVID lockdown. And as a result, we developed the in-house systematic approach to identify potential gaps in health services, health and well-being services. What it does is that it charts a person's well-being journey. You can then subsequently systematically map out the relevant initiatives and the important stakeholders. So for example, most of us here, we are healthy, we have a huge capacity, and therefore we do not need a lot of intense interventions. Some of us are stressed because of certain deadlines that you have to do. You might be missing out on sleep, you might not be eating well, but you're still productive, you still can get work done. Just that I think your health is taking a toll. And there are quite a number, probably a smaller group of people who have medical conditions. It can be a general anxiety disorder, it can be major depression, or it can be any form of a cardiovascular diseases that cause you to be away from work. And that's when you need a different type of interventions. And a smaller group of us who are actually on the road of recovery, be it medical or mental health issues. So subsequently, what you need to do then is to understand among the various group of people that are there will be different type of items and portfolios and programs that you should actually be setting up. At the highest level, among the senior leaders at the level of culture and strategy, do you have a mental health steering committee that is chaired by a C-suite equivalent or a CEO equivalent to implement mental health and well-being strategy and also to allocate resources? At the HR level, do you have a policy that help managers to set expectations, flexible framework adjustment, work adjustment and leave support? And then for people who require recovery, do you have a work adjustment policy? We know that a lot of companies have EAP, but this category over here tells you that the limits of EAP, it doesn't provide help for people with major depression, it doesn't. Your EAP support is only a form of first aid. And at the most it can do is actually to help people who are stressed or who are at risk. But otherwise, if you have got general anxiety, major depression, post-traumatic distress disorder, you can't use EAP. You need medical. So you need psychiatrists, you need clinical psychologists, you need cognitive behavioral therapy. So in that regard, you need to look at whether or not your medical plan provides that form of coverage. And if some people do have the major depression, it usually takes approximately 3 months to 6 months to recover. So the question is then, do you have a mental health return to work services to help them return to work? Then when you bring in more stakeholders, you find that, hey, there's actually a lot more services that we can do. Then the question is, do we have peer supporters? Can the peer supporters actually start coming into play? Do we have a quiet corner? Do you have a net pot? Do you have gyms? And do we want to actually think about providing disability income support? So you can find that the programs can get a lot more for you to actually consider. But when you use this framework, it tells you how holistic your organization is in terms of providing a comprehensive support for mental health of your friends. And you color code it. So subsequently, you can then outline which are the programs that you want to work on. Now, the programs that are highlighted in red color that you're seeing here, they are programs that have been implemented since July 2020 for the past 2.5 years. And you can see that we have implemented so many programs over the past 2.5 years to improve the health and well-being of our people. Then you can do a bit of color coding. It becomes a heat map. So for programs, you can see that if their programs are in place, well, they're color-coded as green in color. I mean, the color resolution is not clear over here. Tomorrow, in my keynote speech, I'll be sharing some of the slides. I think the slides will appear clearer, and then that's when you can better appreciate the color resolution. Moving on, this is also another approach, a systematic approach of approaching workplace mental health of support. Now, at the most basic level of care is what is known as a self-care. Do all of us, do the employees have access to a library of resources to improve their own health and well-being? And then this is followed by the peer support care. Or do we have a critical group of peer supporters in our team to actually provide a safety net for our colleagues to reach out to? Are our managers trained to actually help support people who have got health and well-being challenges? And lastly, do we have EAP providers? Do we have in-house psychologists? Would you want to invest in that? And a smaller group of people will then subsequently require a specialist care, whether it's a psychiatrist or psychologist. Now, in the context of NUS, what we have is that we have a peer support program. And this peer support program, for the past 2 years, we have trained more than 160 peer supporters. And you'll find that every peer supporter, and if your companies want to actually start training some of our peer supporters, we can also do the training for you. Yeah. So the peer support staff trained, right? They felt very prepared to support a distressed colleague. And therefore, this will help improve the culture of care in your company. So these are some of the things that we have done. There are quite a number of other mental health initiatives in NUS. So internally, we have a team of psychologists whereby they are able to provide mental well-being check-in. So which means some people are just feeling stressed. You only need the one-time check-in with the person, and that person feels much better. And then there are those managers who requires training. Now, when you have a manager training, does it include the mental health elements in terms of what is the role of a manager in handling employees who have got mental health challenges? And there are quite a number of other items, such as occupational mental health. We've heard of occupational health. We are good in it. But what about occupational mental health? How strong are we and how comfortable are we in handling occupational mental health, especially when it's work-related mental health challenges? I want to spend a little bit of time to talk about campaigns, because campaigns play an important role to demonstrate the company's emphasis on health and well-being. And it also helps to harmonize the community's understanding of key messages and the company's stand to mental health conditions. This time around, I'll just be only focusing on the Are You OK campaign, which we use it to destigmatize mental health conditions and try to drive resource awareness among our people. Now the question is, does this type of a campaign work or not? Because a lot of people say that, wow, there's a lot of money spent into it. Does it really work? So how we did it? In 2021, when we first launched this campaign, we sent through emails, intranet, and articles. It managed to hit approximately 70% of our staff, but among the students, it only hit 25%, which is very low. So this year, we went into social media. We spent a good amount of money into creating social media content. We went into Facebook, we went into LinkedIn, we went into Instagram, and we paid the advertisement fees, which means if our people, whether they are students or staff, when they scroll up, our content will appear and engage with them. And very interestingly, when you invest in social media, you get a lot of data points. And the data came out to be very impressive. 4.6 million impressions on the post that we have created. And that, when we saw the numbers, we were like, wow, 4.6 million. I mean, for you to reach 1,000 staff is already challenging. This is 4.6 million impressions. Of course, when you go out into the social media public area, you also have publics who are viewing your contents as well. So maybe that's also the reason why, even though we try to focus on students and our colleagues in the social media space, other companies and other employees from other companies also come in to view our content. Now, the post engagement, 64,000 post engagements, they are referring to people who comment, who click like, or who share the post that we have. 64,000 post engagement, that is seriously a huge amount. Then the question is, does it really work? So we did a survey, because even though you have an engagement, you have people looking at your post, does it change behavior? And that's exactly what we want to ask. So we did a survey, and we find that, number one, we have improved awareness. It is an 8% increase among the staff from 70% to 80%. And then among the students, bigger increase, because students use social media a lot, right? So we managed to have an increase in the outreach from 28% to now 46%. And subsequently, we also noted about something. Staff and students had better mental well-being at post-campaign, and this is statistically significant when we did the test. And it's something that we really, really enjoy looking into and say that, wow, our campaign has really helped shifted the needle in the area of our mental health conditions. We also want to take a look at stigma. So does it really improve the stigma among our students and staff? So among the students, we realized that students who have heard of the campaign had significantly lower personal stigma scores and lower social distancing scores. The same finding was also found among the staff. And staff who had heard of the campaign, who engaged with the campaigns, had significantly lower personal stigma scores and lower social distancing score. When you say that you have lower social distancing score, it means that the staff is more willing to work with a person with mental health conditions. Typically, if I were to ask you, how willing are you to have this colleague who has got depression to work with you in the team? Initially, the group of people would say, not really. But after going through the campaign, consuming the content, and understanding what our stand is, they actually are more willing to embrace the colleague into the team and to work together. So that's social distancing. And we have improved the social distancing score among our staff and students. And then we also noticed that staff who have heard of the campaign were significantly more likely to endorse that they will disclose to others if they have depression, which means they're more likely to step out and seek help if they have a depression. And there are even more findings. So this is what we have mentioned just now. Staff and students who are aware of the campaign tend to have higher stigma score, more willing to support people with mental health issues, better attitude towards seeking help, and they have lower stress level. Staff working in the workplace with better mental well-being and better engagement are less stressed. Staff and students who are more willing to seek help for mental health are also less stressed. Year on year, the staff stigma score has improved. And friends, that is occupational mental health for you, right? If you improve the occupational mental health, the culture of safety in your workplace, you can actually improve the productivity. Because why? You can see that if there's better mental well-being, there will be better engagement. If there's better engagement, you will drive your company ROI much better. We also talk about other programs that are there. So we have volunteer leave benefits. You know, we try to give additional vacation leave for our people to undertake volunteering activities or corporate social responsibility. And we also do that for some of our students and staff. But why is it that we want to ask our staff and students to volunteer? Because when they volunteer, they increase their happiness. And this is the data, again, that we got among our students, that if I were to actually increase my frequency of volunteering to approximately once a month, you can see that the happiness level actually increase. And these are statistically significant as well. On the other hand, if you over-volunteer, what happens? Fatigue starts to come in, and that's when the happiness and satisfaction actually decrease. So, if your company has got corporate social responsibility, you need to put a positive spin into it, because it really helps to drive staff happiness when they think about the meaningfulness of the work that they are doing. Let's talk a little bit about physical wellness. Now, we have more than 6,600 staff covered with free health screening. These are some of the general statistics that you can see. More than 100% of the stores, drink stores, because we have canteen, right, to serve lower sugar drinks as default options. Our vending machines has 100% of it would have at least 70% of their products with healthier choice symbols. Yeah, so you can see that there are quite a number of stuff that we try to improve in terms of nutrition options among our staff and students. We also have the chronic disease management program to actually have a case management approach for people who are suffering from diabetes, cholesterol issues, and hypertension. Why do we actually want to invest in chronic disease management program? because the data says that it really drives a good and positive return on investment. And this study was published in RAND Corporations in 2014. As some of you might have read it before. So this is a 7-year study. They study big companies like Pepsi Cola as well. So Pepsi Cola is one of the companies that participated in this survey. And what did they say? What does it show? It shows that if you were to invest in a disease management program, your return on investment are realized in shorter term, which means over 3 years, 4 years, you will already get the return on investments. On the other hand, if you were to invest in lifestyle management program like increase in Zumba classes, increase in physical activity, healthier options of nutrition, your benefits are realized longer term, maybe about 10 years later. So if you will need to actually do a bit of a prioritization in terms of what type of programs that you want to do, then you should know how to, which one to actually do. If in doubt, just focus on chronic disease management program through the case management method. And the return on investment has been calculated before. For every $1 you save in the disease management program, you get back $3.80. That's a lot of money. Compared to if you were to invest in lifestyle program like healthy eating, physical activity, you get back 50 cents. Yeah. But if you were to invest in both together, you still get a positive return on investment of $1.50. So that's not bad, right? So this is one way of having the conversation with senior leaders using all this published data and then invest in them. So we continue to invest in the personal wellness because I think it improves the whole employee engagement also with our company. We have a lot of physical fitness classes, 13,000 of them for staff and their family members. Summarizing it, because today's conversation is about WHO actions, right? Model for our health and well-being actions. You must remember the 3 key principles. Number 1, you must actively invest in evidence-based health and well-being initiatives. I've shown you how to do it. Number 2, you must measure your outcome. And there are many ways of measuring outcome because we are occupational health practitioners over here. Do think about what are the health outcomes that you want to generate and be persistent in collecting the data year on year. And then when you compare them across, you'll be very surprised with the type of data that you're receiving. And all this, when you put together, it shows that the company cares. And that's also the reason how we won the Global Healthy Workplace Award in 2022 with all that you're seeing over here. This is the last slide that I have. If you want to keep in touch, and if you want to take a look at some of the mental health framework that we mentioned just now, it is all in the website that is listed over there. Okay. Let me see the next slide. And this QR code is my LinkedIn profile because I just came back from the other side, which is on application of social media in occupational health. So LinkedIn is one of the community whereby you might want to actually invest in it. So you can scan the profile and then we will be connected on LinkedIn. This is my last slide and I'll pass the time back to the chairperson.
Thank you, Dr. Andrew. Very nice presentation. If anybody has any questions, they can ask.
So as always, I will have a question. Sorry, I can ask you two questions.
Great.
Just curious, what is the social media of impact at on you, say, for the life? Is it Instagram, is it Twitter, Snapchat, what is it?
I have the similar questions over on the other side. Why didn't we invest in Twitter, right? Because Twitter is not very popular in Singapore. TikTok is popular, Instagram is popular, Facebook is popular. But, however, the cost is different in advertising. So Facebook and Instagram are the cheapest if you want to invest in advertising. So you can reach out to them. And then as you put your content there, you boost the post, you spend this certain amount, X dollars. If you were to go into LinkedIn, which is the professionals, which would be your staff, then the cost is 3 times to 4 times that of Instagram and Facebook. If you want to go into Google, YouTube, it's still quite reasonable, slightly more expensive than Facebook and Instagram, but cheaper than LinkedIn. TikTok is a whole different algorithms. Even the post is also different. It is video post. It's not articles. It is not pictures. It is video. You got to do dancing, animations, and it has to be high energy. So you need to look at the profile of the people that you want to target. So LinkedIn will be working professionals, so that will be your colleagues. If you want to target the Gen Z, then we might have to go into Reddit, Instagram at the very start. If you have somebody who can do content on video, then you can try TikTok. TikTok advertisement is also expensive.
So just as a follow-up question, and this is really my question, which is, assuming that you was it, and I'm sorry, I must have missed it, did you direct people to a certain place where you counsel them or make them self-help tools, after which you have these fantastic scores, or was it just general acceptance to mental health as a category?
Yes. There are quite a number of metrics that I didn't share. So these are just only the high level. It shows, number one, the intent of the slides was to show that we improve the stigma, we improve the empathy among our students. Did it drive the increase in the visits among our staff? The answer is yes. We find that the staff numbers increase. It overwhelmed our system, which is a good problem because people typically use the EAP, the utilization of EAP is very low in Asia, but for us, when we saw an increase, we are very happy. So the answer is yes, it increased the profile, and that resulted in a lot of data collection. When they come to visit us, we diagnose, and then we are able to do a risk stratification. Well, we got a lot more data, which I'm diminished to share now. Yeah. No worries.
Basically, your job is a testing and research work, right?
No, it's very similar to Dr. Ashish, whereby you take care of the health and well-being of your employees. I'm not a researcher.
You have shown here the 45,000 students, something like that.
Yep.
So, what are the occupational diseases you have come across in your institution?
Occupational diseases, right? So they are the usual, the contact dermatitis, the occupational asthma is very low because I think the engineering control is good. But what we saw more concerning are the safety practices. For example, when in any university there will be a chemical lab. And in the context of the chemical labs, the storage, the retrieval, and the placement of all these items need to be very properly adhered to. But students, being students, they think that they live forever. And therefore, where I've seen before that they took benzene out and then they leave it on the table, not even on the fume hood. That is really, really irritating to see, even though we have emphasized again and again that you need to observe some of these data points. Now, we also observe that there are different behaviors among people who are locals and international students. And we find that the international students who are here for the postgraduate, they tend to have worse behavior. So the behavior become riskier. So when it comes down to health and safety adherence. Now, occupational diseases are still less so because I think there's also underdiagnosis. Musculoskeletal being one. Usually we will treat them as aches and pains, but we didn't classify them as occupational diseases because it's just there's no standard screening tool to actually try to identify whether this person is having a wrist pain because he's nursing a baby at home, or is it because of working in the workplace. It is just hard to actually differentiate that easily. I hope that answers the question to a certain extent. Thank you. Yes. Yeah.
Do you use different softwares or tools to measure the efficacy, not the usage, but how much difference has it really made to somebody who's using the services? How do you measure that?
Yeah. So let's talk a little bit about the data points as a reference. The data points that you saw just now, where I said it's statistically significant, those are the data points from a pre and post survey. And importantly, it's not the survey, but the survey tools. Are they validated? So the answer is yes, they are validated, and we'll be happy to kind of like collaborate with anyone who wants to come in and say, hey, what are the tools that you use? Can we adopt your mental health framework? The answer is yes. They are all free of charge. The reason why we are here is, why I'm here is to actually try to make an impact in this occupational health community whereby we can all level up together. And therefore, the resources that you're seeing over here, a lot of them are free. And therefore, the idea is to actually share good practices and so that we can level up together. Now, in terms of the statistical tools that we use, I think it doesn't matter if we use SPSS, R, or my favorite is Stata, that you're going to get the same finding as long as the raw data are the same. Yeah, so we get the pre and post survey data points to actually do that studies. I hope that is helpful.
No, actually, but the principle, regardless of the technology, the principle is to get feedback from users, right?
Yes, that's right.
So it's in the space of the feedback they feed from. There's no other quantitative method of checking this, right?
So we have moved on from quantitative data. There will be some qualitative data. Now, when we enter into the social media space, again, the data is not shown over here, but it was shown just now in the other presentation that I did, was that when we went into social media, there are a lot of qualitative data that come in. The qualitative come in the way that the people comment at your post. And each of these data points, even though some of them are sarcastic, some of them are nasty, but it gives you an idea as to what is happening. So that is the qualitative data points. And number two, you saw the data points that we have, 4.6 million impressions. Can you actually do some form of data analytics around it? Because it talks about the behavior of the person on the social media space. That to us is a pot of gold. The answer is we are still looking into it. Now all this comes into this area known as the digital phenotyping. It is a big space. It is one area that we are looking into. How can we actually assess the well-being of our employees by monitoring the rate of them sending out their emails? Can it be done? Yeah, so these are all passive data in the background that we are looking into. Again, I don't know whether I will be sharing that tomorrow, but you will be able to see how when we implemented the NUS Wellbeing Days, whereby the whole company shuts down, did the well-being of our people actually improve? And how do we actually measure it through some of these passive background data points? So we have moved on from survey data points to trawling some of these vast amount of data points, whether in the social media space, whether is it from internal data points, whether is it from IT, to try to collectively form a behavioral phenotype of the community. Now that is an advanced science that we are willing to spend a bit more energy to actually work into. Yeah, I hope that actually helps answer your question.
Very much enough to have a longer discussion on this.
Yeah. So the keyword is digital phenotyping. Once you search for digital phenotyping, I tell you, it will go down a rabbit hole of understanding how data can be used to describe a person. Yeah, so there are two questions here. Okay, he stood up first. I'll come to you later, okay? Yes, sir, you. Yeah.
Should I go ahead?
Yeah, go ahead.
So my question is on the same grounds. How was the ROI calculated?
ROI calculated, okay. The ROI that you saw over here, I think it was the Rand Corporation study that you mentioned just now. If it is the Rand Corporation study that was actually described earlier on, let me see if, yes. Is this the one that you're referring to? Yes. This is the one, yeah. So this is actually published. This is not done by us. This is by Rand Corporation. The data, if you look at the Rand Corporation, rand.org/health, and then look for this. Sorry, I can't remember the title. It is calculated by calculating the 7 years, the number of claims, the outpatient claims, and also the catastrophic diseases. So for example, if I were to treat the person for hypertension, the medicine is very cheap, right? If you treat it. But if the person versus a person who is not treated for hypertension but get a stroke and went to ICU and internal hospitalization, that one hospitalization, if you were to save that, right, is a huge amount of money compared to the amount that you spend on treating the hypertension. So that was the data points that they got in the US based on this study. I hope that answered the question.
But how would we apply this to the mental well-being?
Yeah. The mental well-being one is more challenging. You are totally right. And we want to move, if you look at all the data points that I've shared just now, we don't use ROI anymore. Because if you, in this day and age, you go to a professor and talk about ROI, they will criticize your model of calculation straight in. So we went straight into value of investment. So what is the value that we are trying to create? So number one, stigma. We reduce stigma. We improve empathy. We show that employees are less stressed when they have a better well-being. So all these things actually will talk about the value component of it. We move away from ROI because it is, no matter what numbers that you give, they'll keep on criticizing, especially when it's mental health. So we avoided that conversation.
Just one more question. Post-COVID, this study was done in 2021, right? So what difference do you find pre-COVID and post-COVID among these studies?
Okay, so we did 3 studies, serial cross-sectional. So one is 2021, that's a pre-campaign. Then 2021 post-campaign. And then another one last year, 2022 in August, July. We show, there are different things that we measure in these 3 time points. We start to measure the employee engagement only last year, so that became our first baseline, so we couldn't compare the year before. But we found that staff, the stigma score has improved year on year as we continue with the campaign and driving the resource awareness. So that is one big trend that we have seen because that data was collected year on year. Among the students, we just want to increase the outreach. We find that the first year student and the second year student are the least rich, but the third year and the fourth year students are better. So we need to understand what is the behavior of the first and second year to improve the outreach. Yeah. So to you, I think you wanted to ask a question. Okay, I'm trying to get the question right. So which platform is safest to share data points? Oh, okay. I used to work in Facebook. Facebook owns WhatsApp, so I can tell you that. WhatsApp is the Facebook doesn't have access to your WhatsApp. It is end-to-end encrypted. Telegram has a server somewhere in Russia. And that gives you an idea how data can actually be used, because even though they say that it is secure between you and the end user, but it is Russia and it is the respective company. So we use, as long as the server is in the respective companies and you own the server, you always have access to it. So I leave it to you to discover. But more importantly, try to use Microsoft and all those things, because I think they have a very good and strong reputation in trying to secure the data points. So if most companies will be using Microsoft, and if you use Microsoft, you'll be using either Skype or Microsoft Teams. Use Teams, please. Don't use Microsoft Skype. Teams is very, very secure. Oh, individual. Try not to share sensitive data if possible. Okay, I don't know how much time we have. We are okay. 10 minutes. 10 minutes more, is it? Okay, yeah.
So the answer is none of the
Yeah.
above. Yeah, that is true.
Yeah. Yeah.
You cannot put it in the social media.
Yeah, you try not to. Yeah.
I think it's sharing of information and awareness, not the sharing of data.
Share.
What you are thinking about sharing the social media.
What do you share?
What do I share in the social media? So the social media, if we go to the slide on the social media, you will find that we are actually sharing on things that are quite generic. Yeah, we don't share on data points. We share on our journey in trying to. They are very generic, feel-good messages to engage the person and asking them to click on it to engage with our resources. So if you were to take a look at the messages that are out there, they are very generic, feel-good, try to engage with the person. And it varies from time to time and the season. So it's neutral, they're quite neutral. We don't share data on our Instagram and Facebook. Yes, create awareness. Yeah, correct. So, but subsequently, when they click on it, they'll be sent to our website. And if they want to make appointment, then that's when they key in their messages, right? Yeah, but it will be on our website. It's no longer on Facebook or Instagram. Yes, you have a question?
So the question is whether we not have any covered by the employee for this calculation of the return.
Okay, I didn't manage to hear you. I think do I have Yeah, calculating the ROI.
Right, you are calculating the number of claims settled by the right for the or the treatment which has been provided to the employees, and you calculated by the claims, right?
Yeah.
So are you considering the sick leaves for these?
Sick leave, is it?
Sick leaves for the employees availing the sick leaves for their any type of comorbidities.
Yeah. Typically in ROI calculation, sick leave is used as a direct cost. So in the calculation of ROI, you need to have a direct cost and an indirect cost. Now, sick leave is a direct cost. Insurance is also a direct cost. The medical costs, these are all direct costs. Direct costs of also hiring a contract worker to provide the person, those are also direct costs. Indirect costs is where employees now have to double up to work for you. So that one is indirect cost. It's still a one person that you hire. It's just I work harder to take care of the job for the other person. So that's indirect cost. The other indirect cost would be the morale of the team. If the morale of the team is low, then you're going to have attrition. Attrition is a huge cost. So that is, again, an indirect cost to calculate. So in your model of answer, you must always list out the methodology clearly. So if you only put yourself as identifying only the direct cost, then you are less prone to criticism. So just the medical claims, the insurance premium, the cost of hiring the contract staff, and also the absenteeism. So those, if you were to just calculate that, you won't be wrong. Yeah. Thank you.
Thank you, Dr. Andrews, for a wonderful session.
Yeah, thank you so much.
And now I think we all have, he needs a great, sit down. To summarize, I think we have all very great speakers with us who has enlightened us with the WHO Healthy Work model, this thing to place to work for. And I think we all are doing everything in our organization, but the model is guiding us how to assemble and everything, how to put it forward for the with our management, and so that it can be implemented for as an holistic approach, and an integrated occupational health services is the better thing. And now we'll close the session and with this, and I'll invite Dr. Ashish to do the proceedings further.
Thank you so much. Thanks for being a lovely audience. We had our own shares of ups and downs in the morning, but I think in the end, all is well, which comes out well. I really want to thank all of my co-panelists out here, the speakers, Dr. Andrew, who has come in from Singapore. We have Dr. Sandeep, Dr. Sriniket. We will all be breaking for lunch now. And for all of you who would be interested in the financial well-being aspect, there's a PDC in the other room on financial well-being, which begins at 2 o'clock. So looking forward to the break. Let's get some sunshine and some nutrition. Thank you.